In the program because I want to get you out in time for you to be able to get on with the rest of your day. Before I introduce Michael Tanner, though, as a country that believes in these founding principles, and in my introduction, I failed to ask you to stand and join me in the Pledge of Allegiance. So I'd like to ask you to do that. Thank you. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Please be seated. We're going to go ahead and get started. Michael wants to leave time for questions. So I'd like to introduce Michael Tanner from the Cato Institute, Senior Fellow there in Washington, D.C. Michael heads research in a number of domestic policy issues, including obviously health care, Social Security. He is the author of numerous books, most recently Leviathan on the Right, How Big Government Conservatism Brought Down the Republican Revolution, which I think is particularly apropos. As a free market organization, we're oftentimes have been kind of tagged as a Republican organization, and we're not. We're for limited government, and regardless of who's pushing for big government, we're going to kind of take on those folks. And so I appreciate the title of that book. Michael has also, as I said, worked on Social Security. It's been an extremely important issue for him and is one of the kind of godfathers of the private accounts for Social Security, which unfortunately the mantle didn't get carried very far under the previous presidency. His other books include Healthy Competition, What's Holding Back Healthcare and How to Free It. He has testified before Congress too many times to count, has been traveling the country, speaking and discussing this issue. What we appreciate about Michael at the Institute is that I think you're going to be able to understand what he's talking about when it relates to healthcare. He won't bury you in acronyms, and he also offers solutions to the issue of healthcare as opposed to the government control. So please join me in welcoming Senior Fellow from the Cato Institute, Michael Tanner.
Thank you very much, and I appreciate you taking the time out from your day to come out and hear about healthcare. I'm glad you ate first, because usually after I talk about healthcare, it sort of spoils people's appetite when I talk about what's going on in Washington. I also have to say it's a thrill to be back here in Jacksonville. It's a beautiful city, and I really appreciate the opportunity to see it. Just a lovely view and everything from here. Although I will add the caveat. I not only work, but I live in Washington, D.C., so it's always a thrill to be somewhere else. And I do get the opportunity, though. One of the things with this job that is, I think, particularly important is that I do get to travel. I've been in 49 states in the last 5 years to talk about health care. And I've actually had a chance to be overseas a great deal and to look at healthcare systems around the world. Not so long ago, actually, I was in England, and I was looking at their healthcare system, and we can talk a little bit about that if you want later. But I did have some free time while I was there, and took off and wandered down into Hyde Park. I was going to go for a run. I do recommend, if you're ever in London and you get some free time, you've got to go down to Hyde Park. It is just absolutely beautiful. But I don't know if people are aware that one part of Hyde Park, there's what they call Speaker's Corner, where there is a soapbox that's actually built into the sidewalk. And anyone can come along, and you can get up on that soapbox, and you can just start talking. And you can talk for as long as you want, and it doesn't even matter if you know what you're talking about. It's kind of like Congress. The day that I was there was a gentleman. One time I ran up there, he was sort of in mid-speech, and he'd had quite a crowd gathered around him. And he was saying, "When the common man takes over, we'll all be drinking champagne." But from the back of the crowd, there came this little voice saying, "Yeah, but me and me mates, we kind of likes our brew." Well, the speaker just sort of ignored that, and he went on and said, "When the common man takes over, we'll all be wearing tuxedos." Sure enough, the back of the crowd, and that little man saying, "Yeah, but me and me mates, we sort of likes our tweed." Well, the speaker getting a little bit upset now, but he carried on and he said, "When the common man takes over, we'll all be smoking big cigars." You guessed it. Back of the crowd, little man says, "But me and me mates, we kind of likes our pipe." Well, the speaker, he jumped down off the soapbox and he pushed his way through the crowd. He found that little man, he grabbed him by the lapels and he said, "When the common man takes over, you'll do as you're damn well told." And somehow that immediately made me think of the whole healthcare debate. Because we're told that healthcare reform is all about helping the common man. We're told that it's about fixing the system for those people in our society who need help. But if you look at the plans that are actually going on in Washington, D.C. right now, they are plans where at the end of the day, we are all going to end up doing as we're damn well told. And what I'd like to do, if I can, is talk to you a little bit about the context of healthcare reform right now, and then answer some of the questions that I get asked a lot about what's going on in Washington, and then maybe see if I can finish up with some alternative solutions to what they're talking about. The first thing is, I think it's very important to put this whole healthcare debate in context, because there's some things we sort of forget about. And that is that for all the problems that are facing the U.S. healthcare system, and I'm going to talk about those in some length in a minute, but for all the problems that are facing the U.S. healthcare system, we still in many ways have the finest healthcare in the world. We lead the world in innovation when it comes to healthcare. Of the last 25 Nobel laureates in medicine, 18 are either U.S. citizens or did their research in this country. Of all the pharmaceutical products introduced worldwide over the last 40 years, more than half are patented in the United States. And of non-pharmaceutical medical breakthroughs, ranging from transplants to MRIs, 80% were introduced first in the United States. So when it comes to healthcare throughout the world, the U.S. is the engine of innovation that drives the quality of healthcare for everyone else around the world. And we have more choice in this country than most other places. Now, not as much choice as I would like, and I'll talk to you at the end about how I'd like to see us get more choice. But we do have more than a lot of other countries. We have choice of doctor. There's countries where your doctor is assigned to you based on your street address. You live at a particular address, there is a doctor who is the doctor for that address, and that is the doctor you will go see. We have the phenomenon in this country of people move to get a better school district. There are actually countries like Spain where people move to get a better doctor. We have more choice of hospitals you go to. We have more choice of the treatments you get when you get to that hospital. And even if not as much as I would like, more choice of how you pay for it, what type of insurance plan you have and so on. And then finally, we lead the world when it comes to the quality of the care we receive. When Silvio Berlusconi, now the former, then current again, Prime Minister of Italy, needed heart surgery because bouncing around with teenage models was a little taxing. He didn't stay in an Italian hospital. And he didn't go to Canada. He didn't even go down to Cuba with Michael Moore. He went to the Cleveland Clinic in Ohio. And when Beverly Stronach, the Canadian Minister of Human Services, came down with breast cancer, she got treated at the University of San Francisco Hospital in California. And they were simply following in the footsteps of tens of thousands of patients from around the world who come to this country every year to get their health care treated because they know that this is the place to come if you're sick. Now I know there's a lot of studies out there that say that, well, we have problems with the quality of our health care. Michael Moore, if anybody saw Sicko, very, very funny movie actually. But he quotes a study in there by the World Health Organization that shows that the U.S. is 37th in the world when it comes to quality, right there above Slovenia. Well, there's a few minor problems, of course, with that study.